Hi there, welcome back to the Nurse Coach Duo. Today we're excited to be joined by an inspiring fellow nurse coach and wellness advocate who is helping transform the way we think about healing and whole person care. Our guest is Kristine Davidson. She is an Integrative Nurse Specialist, a board-certified holistic health and wellness nurse coach. Kristine is the founder of Soul Health, a concierge integrative nursing practice where she helps individuals regulate their nervous systems, reduce stress, and reconnect with their health through personalized, evidence-informed holistic care. What makes Kristine's work especially unique is the way she combines nurse coaching with a variety of integrative healing modalities that support the body's natural healing processes. Her work is grounded in the belief that true wellness involves caring for the whole person, mind, body, and spirit. You'll have to listen up for those modalities. In addition to her clinical practice, Kristine is a passionate educator and advocate for advancing integrative nursing within healthcare systems and communities. She has presented nationally on nurse well-being and integrative care practices and is the creator and leader of the Advocate Health Integrative Nursing Symposium, an initiative dedicated to supporting healthcare professionals and promoting healing-centered care. Today, we're diving into an important conversation about nervous system regulation, stress healing, and the powerful role nurses can play in helping individuals, especially women navigating midlife and other high-stress seasons, taking a proactive approach to their health and well-being. We will explore how nurse coaching and integrative modalities can work together to support resilience, why nervous system regulation is foundational in health, and how simple, practical tools can help people feel more balanced, connected, and empowered in their daily lives. And beyond all of her professional accomplishments, Kristine is also a wife and a busy mom of 3 young boys who understand firsthand the challenges of balancing caregiving, family life, and personal wellness. We welcome Kristine. We are so excited to have this conversation and love being a nurse coach trio.
Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider.
Hi, welcome to the Nurse Coach Duo. My name is Angie McGuire, and I own Coach Angie out of Oak Park, Illinois.
And hi, I'm Jen Shore with Clarity Health and Wellness Coaching. And today we have fellow nurse coach Kristine Davidson with us. Welcome, Kristine.
Hi, thank you. I'm so happy
Welcome.
to be here.
Yeah, we love it when we can be a nurse coach trio. We
That's
really
right.
love to bring as many nurse coaches on as we can and let the audience know what we're doing out there in the community. And we tend to talk a lot about different modalities and different ways that nurse coaches are out there helping. And we also bring other experts on as well, just about how, Angie and I say it all the time, it takes a village, right? It takes a village
Mhm.
to get through this life and trying to get through it healthily. And I'm not going to say stress-free. I don't know whether we'll ever be stress-free, but stress less
Mhm.
maybe, So we just wanted to kind of get going with starting for asking you, like, why did you choose nurse coaching? And then how did you choose the integrative modalities kind of as an approach to use with your nurse coaching?
Yeah, thank you. So it's funny reflecting when we go through our nurse coaching training. I had a friend who told me, Girl, you were always a holistic nurse. I was an ICU nurse and I would, in the night shift, turn on soothing music and give them a bath and really like lotion and hold their hand. And it was almost like, it's a calling. It was always part of my practice. My dad got sick and I was fortunate enough to be able to support him during, his end of days. And I really dove into how I could support holistically. And then, almost with his guidance spiritually, I was led to nurse coaching and I was like, this this is exactly what I've been talking about. And there's a name to it, and it is fairly new. And so it was just so exciting to be able to be in a cohort of like-minded people who were just like, yes, we want to support people holistically. We want to support them in their goals. It's not about me. I'm just a conduit of what I'm bringing to them and giving and holding them space. And then the integrative modalities just kind of followed. I found the things that really spoke to me when people were telling me, it's a lot of stress. It's a lot of life feels overwhelming. And I just found these tools that I could offer and sometimes even be a segue into nurse coaching. Like, let's just try these ear seeds. And now that you've tried these and you've found space for this, let's find space for what is important to you. And then we get kind of into the coaching space. So it was just a really great way. Not everybody is the same. We don't all heal the same. And what we gravitate to is not the same. So having a toolkit of things that I can offer people when I help them is really been beneficial. And that's kind of how I've dived into the different modalities as I've grown.
Yeah, that's amazing. I love that you use the toolkit. I mean, Jen and I talk about the midlife toolkit. It's so important to have, whatever age you are. But certainly as, we go through different times of our life, right? Jump in. I want to dive right into those toolkit. Tell us a little bit what's in a toolkit and how do you present it? How do you offer your different modalities when you meet your clients?
Yeah, so I'm still working in the institution in the healthcare system, and I'm so fortunate that I was able to land a role that is an integrative nurse specialist role. So I am actually consulted into the patient's room
Oh my
specifically for
goodness.
these healing modalities. I just,
Wow.
praise. So they already kind of know maybe when I come in a little bit because maybe someone has introduced the idea of, or maybe the patient themselves has said, I don't want to keep taking all these medications. I need something else. So it's sometimes just me introducing the idea of holistic and just mind, body, spirit, energy, environment. We are all of those things. And even though our Western, tends to want to just pick one and stick with it, I come in and say, okay, but we also need to look at all these other pieces because they play a role. And, a lot of the nurse coaching is finding the root, finding what speaks to them, and then supporting them through their journey. So really, I come in, I kind of give a little spiel, as I just said, and then I say, you know what, tell me, what is most uncomfortable to you today? And in the community, same thing, I do pop-up events where I go concierge into people's home, and it always starts with that initial question, what is most important to your health and healing? Where do you feel that you need support? And then I work with them through there. So it's just about giving people the time to be heard, to listen to their full story. I think sometimes they don't get enough time to share that. And then I can come in and kind of tailor the modalities based on what they say to me. Also, I know you all know, as my nurse coaches know, there's a bit of intuition in it. It's what intuitively comes to us, or that what is given to us that we know we need to pass on. And so I kind of drive based on what the partnership feels correct is feeling and aligning for us. And so I will kind of give them that little spiel. I'll tell them these are the things I offer: aromatherapy, healing touch, foot reflexology, and auricular acupressure, on top of like guided imagery and, of course, the coaching perspective. And so either they'll say, ooh, this really sounds good to me, or if they tell me something specifically is going on, I can say, I know that these modalities tend to really support people. Are you open to this idea? So it's really just a genuine exchange, making sure that they're open, that they trust what it is that I'm offering. And then, of course, in nursing fashion, we're always reevaluating, making sure that that feels good to them, and kind of moving on from there. I could tell you a little more, but
No, I think that was amazing, and I'm so impressed with the hospital that they're allowing you to do that at the bedside, and because I think you're just in your kind of your opening and talking about nurse coaching, how many nurses are actually out there already doing it and not even recognizing that that's what they're doing, right? I mean, I remember being at the bedside being like, like, okay, I'm gonna, like you say, paint your nails, or like my mom when she was in the hospital, she doesn't go a day without having lipstick on, like, so like I brought in her lipstick and I fixed her hair and all that kind of stuff, like, and those things matter so much. And, we can't always expect the nurses to understand that that's what it is, because granted, when you're in ICU, you have a little bit more time, not always, but we have more time with our patients than some others. But what a beautiful way to make the person feel important, feel seen, and then also supported in a time that is just so anxiety producing and really can just bring so much calm to them. So I know I hear you in saying that, you let the client kind of say what modality they think they're being interested in. But I'd love to kind of hear your thoughts on why you would choose one over another. When I was in school, I remember learning about healing touch and doing a presentation on it, and I just think it's so beautiful. But like, again, or you're in a hospital, you're in a Western medicine type of thing. Now you're going all woo woo on them.
Yeah.
So how do you, what do you kind of come with an approach of saying this? I really think this is going to help you, or why this would help you?
Yeah. So, of course, we have our patient information ahead of us. We get that intake, whatever that looks like. The two, healing touch is definitely one of them. Healing touch and auricular acupressure are the two that I really have to explain a little bit more, because generally people haven't heard of them. But gosh, the benefits of both are just so incredible. So, for example, for each, we're in the hospital setting, so we'll keep talking about that. Our acute spinal patients that come out of surgery, lots of discomfort, lots of inflammation, lots of stuff has happened in that area, and just nothing seems to help, but they have to get up and move, right? Like that is just part of the healing that they need to do in the acute care to be able to come out of that space. So those patients, and again, because of science and following the evidence, we see how well auricular acupressure works for those type of patients. So I already know going in that I am going to speak to them about that modality. And so I'll let them know, maybe you haven't heard about something called auricular acupressure before. You've probably heard of acupuncture. And so I can kind of tell them about, well, acupuncture is with needles. This is non-invasive, completely gentle, and it stays on your ear for up to 5 days, giving you continuous relief by stimulating the nerves that are in your ear that are communicating with your brain, and then that part of your body. And it's always multimodal typically. So I'll put those on first. And then in that time that I'm with them, I can reassess at the end, and they'll be like, wow, I'm starting to feel a difference. Or, I check back the next day and they're like, it's almost, and I always say this, feeling is believing, which is why I love to be able to check back in on them, because then they're like, wait, what? You did something that nothing has been able to do. And all I'm doing is calming the nerves. And it's not even what I'm doing. It's what their body is naturally doing. It's just a natural remedy to support it. It's a natural vicarious seed that is sitting on their nerves that are communicating to that part of the body. And so that is just, one way. The healing touch, I absolutely love. In the grieving space or in our oncology departments, I really love to offer and support that. And what that looks like is saying, hey, we're energetic beings. Can we all agree with that? We rub our hands together, we pull our hands apart, and we can feel that energy. Or, if they're kind of science brainy, I'm like, okay, what do you think the CT and the MRI are looking at? They're looking at your energy of your body. Right? So just like they're focusing on looking at energy from that space, I'm looking at your energy that's moving through your body. And sometimes our energy gets stuck in places in our body, and that can actually not feel good. And that can come up in different ways. Maybe, when you feel your emotions and you really feel it in your belly or your chest, that is your energy getting stuck in that space. And so, just again, it's not even anything I'm doing. I tell them I'm a conduit of the energy that's coming from above and below and all around them. And I am just targeting that energy to where their body needs it. And generally people, especially when they, unfortunately, and this is something I'd like to change, a lot of people are like, I've tried everything. Sure, why not? I would love it to be, let me try this first, right? But it takes feeling to believing. And then once, the session is done and they are like, what did you do? I didn't do anything. I just supported the energy to help, move through your body. It was something you did. You focused on your body. You allowed yourself and your nervous system to relax so that your body can naturally heal. And so it's almost giving people the space and then letting them experience it for themselves. And then they can be like, wow, there really is something to that energy. And then hopefully everybody shares that, just like nurse coaching, all of these things get shared to their family and friends of how that worked for them. So it doesn't become the last stitch, but maybe the first stitch to help prevent, right?
Oh, I'm so inspired. Oh my gosh. Thank you for sharing. Thank you for sharing just about the patient and the spinal patient and how they were feeling and how you talk about energy too. Cause that is such again, like, especially in an inpatient setting, that really probably feels woo-woo, right? Like no one's doing that. And I'm inspired by your work, in the hospital. And I know you don't only work in the hospital, correct? And we can talk a little bit more about that, where else you work. But I also wanted to go back because this common thread of you giving the control back to the patient when inpatient feel out of control. I mean, it's just they're acutely ill, or maybe even if you're not acutely ill, when you're in an hospital, everyone else is in control. And to feel like a human being and to be given the opportunity to find your own energy and have some control about your healing rather than an IV putting medicine in or what, it's such a beautiful thing to think about, that maybe that's the way of the world in this healthcare. Like, how do we get more of you in the hospital, Kristine? Like how I need to know about this a little bit more, but maybe that's another conversation. But because I really want to focus on what you do and the modalities that you provide to your patients or your clients. So I know you talked about inpatient as far as like outpatient, in the outpatient or your own office or your client's outpatient. What kind of modalities? Are you using the same modalities, or do you find a different modality works when someone's not so up here, or you know what I mean? Meaning nervous system regulation, right?
Yeah. Well, and I know you said that you really support women in midlife and in high stress. And I mean, what a perfect group of individuals to speak to it. And that is a large group of the people that I do work with outside of the hospital setting. I don't want to call it my niche because I really do believe that these modalities can help anyone. And so if someone comes to me and they want the support, I'm here for it and I will support them where they need to be. But women, gosh, we are doing all the things, right? We're managing the household, we're caregiving, we're leading, we're working, we're raising children, we're supporting aging parents. Like there is so much being asked of us. And so generally when I come in, I have women who will just say, I feel like my nerves aren't even responding to me anymore. I'm so up here. I don't even know if I can down regulate. I hear that a lot. Or, there's a lot of the media that they want to assume that it's their hormones. And yes, hormones play a role, but if we are constantly in fight or flight and we are not closing that loop and allowing ourselves to decompress and rest and digest, then our body is never going to be able to heal as well as it could if we can just put our bodies kind of back into that. So a lot of what I do in my soul health profession is I go in again, I do an intake. I always ask, and this is very, all nurse coaching things. I always ask, on a scale of 1 to 10, where would you say your stress is? On a scale of 1 to 10, where would you say your pain is? And where is that? What does it feel like to you? Finding out what things they are doing that are working, and then finding out the things that they wish they could be doing better. Or, as they communicate with me, they say, I can't turn my brain off at night. I'm going in until 2 a.m. Or at the end of the day, if my kid or my husband just looks at me the wrong way, I just lose it. And so just kind of hearing those buzzwords, and it really is multimodal on how I approach them. But it can be as simple as creating an aromatherapy for them, so that in the moment when they're having that moment, they can stop and take some deep breaths. So I always end up supporting and coaching through deep breathing, because that is a way to close that cycle of that fight or flight, to just decrease, down regulate, and really allow our body to decompress. There's the word I was looking for, and come back to a baseline. So providing aromatherapy and some coaching through deep breathing. And then, like I said, my really big hit in the community is the auricular acupressure. So because these women are go, 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 it is so nice for them to be able to just put something on their ear that then it's almost a physical reminder when they come up and push on them. It's re-stimulating the nerve in that part of the body. But we have points for mental clarity. We have points for anxiety and stress. We have points that communicate with your hormones and your pineal gland to tell your body to rest and allow yourself to sleep better. But then they have something physical on their body that they can remind themselves, I need to breathe when I touch these things, or I'm supporting myself right now. Let me do that. Let me stop and do that. So I think sometimes just having someone or something that's championing behind them, whatever it is, the thing that they're working on. I almost feel like, they have me to connect with me, but when they don't have me, they have something with them, either the aromatherapy or the ear seeds, to remind them of what it was they were working towards. I want to be able to enjoy my children at the end of the day and not scream at them. I want to be able to sleep soundly without waking up at the sound of a pin drop. So it can be just so simple as these little shifts, and then getting that out to me, but then providing them these tools that they can do at home and have like those gentle reminders. I haven't talked a whole lot about foot reflexology, but that is a love of many, because we're supporting the whole body. A lot of people say it sounds like a massage for the full body, and I'm just pushing on these targeted acupressure points on the bottom of their feet. But again, it's however I can support that person to get out of the fight or flight. And so sometimes we need to go in and do a big integrative approach where we kind of do multimodal. And then once we've gotten that body down regulated with the foot reflexology and the aroma, then they can stay up with me with the coaching and with the ear seeds, because now they've got a plan going. And once people get motivated and they have someone behind them, they can take it on their own and they can come up with their solutions on their own. We're just there to kind of support and encourage them along the way.
I love hearing you explain that, because I hear the nurse process through the whole thing, right? And so obviously listeners who are not a nurse coach or haven't been through this, they're hearing it and it sounds beautiful, but it's like what we're talking about is we're finding your why, your reason, what you want to get out of it, and we're giving you a tool. You choose which tool. This is again all on them, right? We're being this source of being able to see it more clearly, find the internal why, because we're going to stick to that a lot better. Then find the barriers, right? Hey, what's going to remind me to do these things? So what barriers are going to be? So maybe a physical thing is there, reminding you that your breath is always with you, those kinds of things, and being able to fit it in our lifestyle. Right? It doesn't have to be this, now I have to go to an hour session for this or that every day. We have modalities that can be right at our literal fingertips, and use them to bring ourselves calm, which is such a huge piece of an hierarchy of our health, right? I talk about the pillars of health all the time, but if your sleep is off, that's going to make you more stressed. If you're really stressed, that might make your sleep off. It's going to make you eat different, all of those things. So, we're hearing a lot of the we're going to do stress management, and that's everywhere in social media and in articles everywhere. Everybody's talking about stress management because we are so stressed. But I'd love for you to talk a little bit about either from your experience or just from your knowledge, right? From what you've seen out in the evidence and the research of why the nervous system plays such an important role for our healing and for our lifestyles I mean, it can be for women in midlife, like you've already talked to, and stressed people, but even just in general for our healthy lifestyle and our healing processes when we are sick and we need to get better, why the stress and the nervous system regulation is so important in that.
Yeah, I mean, I honestly believe the nervous system regulation is foundational to healing. I mean, we talked about before all the things that are coming at us. And honestly, our society makes us feel like we have to be go, go, go. But that is not what is naturally intended, right? When that response was created in our bodies, we were cave people and we had to run away from a lion. And that is when those things in your body kicked into gear and made you, run away or fight, right? Because there was an actual attack coming at you. Well, now all these micro things are happening constantly that are putting us in this like chronic survival mode. And I don't want you to hear me wrong. There is good stress too. Stress is not necessarily a terrible thing, but it's how we make sure how we're responding. And then that down regulation piece is what we're missing, because instead of down regulating, at the end of the day, we are so buzzing and overwhelmed that we like don't even know how to down regulate. We just like turn on the TV or scroll on social media. And that's actually doing the opposite of what we need to do, of like that deep breathing and removing ourselves from that constant state of stress. And that can show up as anxiety, insomnia, chronic pain, digestive issues, inflammation, right? Burnout. So we talk about what can the nervous system do? The nervous system is involved in all of the things that people are having ailments about. And, we talk about how chronic disease and all these inflammation diseases can be prevented. Yeah, they can be prevented by supporting our nervous system. And when we begin to support our nervous system through rest or breath work, through touch, mindfulness, setting boundaries, getting more sleep, nourishment, and these calming modalities, the body is able to be more receptive to healing. And people start to think more clearly. They can reconnect with themselves, find what brings them joy, and recommit that into their life. And then their symptoms will soften because the body no longer feels like it has to stay on this high alert. For women, especially, I think regulating is less about doing more because we're already doing enough. It's about creating these safe moments of safety, of presence within ourselves, and restoration. And that is part of, being okay with what's happening culturally, or being okay with being different than what's happening culturally, and just sitting with yourselves. And, the business that's happening is happening. We can try and change that culture, but we really have to start within, with finding that space and time with ourselves. And allowing ourselves to down regulate. And then really it's a snowball. Once you feel it, once you do it, and a lot of people are like, oh, breathing. Yeah, yeah, yeah. But when someone coaches you through it, and then you're like, wow, I actually don't feel like I need to go run away from something or run to the next thing, or my mind is actually here with you, then, it's there, the buy-in is there. And then once their nervous system is regulated, then they can feel the rest of their body healing itself. So it really is the foundation.
Yeah. I so appreciate you going through all of that, like all the different modalities. And you do make it sound simple, but we know as practitioners and coaches that it's not simple. And often we need guidance and advocacy behind it, or someone with you to teach you how to breathe and remind you that so much of this is at our fingertips. And thank you for going through all that. You said it so well. And I just want to shout it from the rooftop here. So I really, really appreciate it. And I think too, like you talk about the foundation and of your nervous system. And once you understand that, then you can, I mean, not to repeat you, but you said, I want to just like sort of um, just celebrate it, is then you can move forward and look at other things in your life, right? That you're trying to get a control of or heal or whatever way you want to say it, but sort of just move forward on things that you feel stuck in.
Yeah. And I
So
mean, that's where the coaching like really shines because primarily people generally need space to process and feel heard and
yeah.
reconnect with their inner wisdom. And I really feel like that's where nose coaching shines because we allow them to have those conversations with themselves and we're really holding space for them to go through that process with themselves. And then they're like, oh, okay, I figured out the barrier. I figured out what I want, and I can move through this. I can be supported to move through this and do it and do it. And then you have your nurse coaching champion that's cheering you on and saying yes you can. And I think sometimes people need those affirmations and believe in themselves. It just maybe just takes having someone to walk alongside you until you feel powerful enough to run with it on your own and then
Mhm.
it just kind of snowballs from there.
And why, this is, I'm going to put you on the spot for a minute here, but
Yeah.
why do you think nurses especially can do that with a person? I mean, there's a lot of people you can go seek help to, right? And as hopefully our care system, healthcare evolves a bit more towards using these modalities on a regular basis. But why is it special? Why are we special? I know you're going to have the perfect
I
answer.
love that. Oh my God. This is exactly why nurse coaching was like, yes, right? Because yes, there's tons of health and wellness coaches, but we are so well positioned as nurses. We have the foundation of how the body works, mind, body, spirit, environment, it's all connected. We have that degree, that licensure behind what we're speaking to. And we're uniquely positioned between clinical care and lifestyle based healing support. We also spend more time with people than anyone else in healthcare. We are always educating, we're advocating, and we're building trust. I mean, we're the number one trusted profession, right? And so we recognize stress and burnout and things that are happening in people's bodies before they even do because we have that background in nursing. And I think as healthcare evolves, nurses have an incredible opportunity to help people be more proactive in their care instead of reactive with their health and be have that autonomy and feel power in taking
Mhm.
control of their own care and understanding how they can support themselves through the different things, the physical support, the nervous system regulation, the boundaries, the self-care without having guilt. And we can introduce these evidence informed integrative approaches because we ourselves have learned them through our training. We know what evidence is behind what. And so, we are a voice of that they can trust. And so that's why I think nurses are just so well positioned to get into this preventative space, and I think more and more people are realizing the scope of nursing is far reaching beyond what we're doing in the acute care space. And so, I empower nurses that are listening to this. If you don't like the type of nursing you're in, there are so many things that we can do within our scope. And so, why not take what you love about nursing, which is probably healing and taking care of others, and channel that into what you love to do and how you can support people healing naturally. And so that's a way that we are so well aligned. And that's why the nurse coaching really needs to be uplifted because that nurse piece, the fact that we do have that background is really, and that trust already with people is really what's going to create that partnership and see someone fully for what they need and be able to support them and allow them to heal beyond symptom management, but be, someone who can truly flourish.
Yeah, and how many, the intuition that nurses have as well, right? Like, I mean, how many times have you been at the bedside and gone, I don't know, doc, things are not going to go good tonight. And they say, well, why do you think that? I just have a feeling, it's like,
Yes.
I don't have any evidence yet, but I'm going to keep, I'm going to have to watch this person closely, and you stay by your phone, because we only kind of almost get that intuition. Or, you go in and somebody is just not acting right to you, and you can go a little bit deeper because you've been with them for enough time. And it is that time. I mean, think about it. You go to the doctor, you wish you had more time with them, because if you had 10 more minutes, you could explain it a little bit more. And then also, I think we have this really great knack of, and part of it is the time and the intuition, but of getting people to see through their own roadblocks and barriers that they're setting up for themselves, that they're not recognizing until we ask the right questions. And then we're like, oh yeah, I do that. Or, oh yeah, why am I not doing that? So it's a very interesting process that I know I struggle sometimes explaining. That's like, well, what can you do for me? It's like, I don't know how to even tell you what you're going to get out of this, but it's kind of like going to a personal trainer. Like, you think, oh, I don't need a personal trainer. You go once and you're like, holy cow, I can't believe how much I learned in that one session about my body. That's exactly what we can do in that one session, of how much you can learn about whatever it is that's going on, and seeing it in a new light. I think it's just, I said this in, I think, the last podcast that when we interviewed another nurse coach. I just think that we are going to be that pivotal point in changing healthcare, because it is just a different focus that we can do. And so hopefully one of these days we'll get insurance to cover us.
It's coming. And,
I know.
another point that I didn't say that I have to say is we're healers.
Yes.
That is innately within us. And so even just you can have the same conversation with us as a nurse and with another type of modality that may be trying to support you through your SMART goals. But because we are healers, they're already getting something from just sitting with us, right? And we're already giving something by just sitting with them. And so it's just so incredible. Sometimes we don't realize we don't have to be doing all these techniques and things. Just being, we are healers.
Yeah.
And just being with someone, we're supporting their healing journey. And so again, that's just another way why having that nurse part in and really uplifting that in whatever work that you're doing, either in the hospital or outside. When you're saying you're a nurse coach, you are bringing in that healing, that trust into what you're doing with them, and how you're supporting them.
Yeah, well said. So, just to wrap this kind of in a nice little bow, we've talked about, how, gosh, we've talked about being in the hospital, and then like kind of pre going to the hospital, but we're still really stressed out part. If you had any advice outside of, all the modalities you use, but like something that we could go home with today to get ourselves to already start to help us down regulate that nervous system, like you say, and to maybe give the proactive approach to it versus the reactive approach. Do you have anything that you really like to give to your clients to use as a modality for that proactive approach?
Oh yes, I've said it and I will say it. I end up talking everybody through breathing, because we all breathe. Breath is how we live, and your body is not working against you, it's communicating with you. So if you can sit with your body and notice your breath and allow yourself to just be, then you can start to notice where it is that your body's talking to you and what you need to breathe into to allow yourself to start to heal naturally. And really, I just want people to know that healing doesn't always mean fixing, and we're never going to fix something overnight. But if you can just start with your breath, and there's so many different types of techniques out there. So you just find what works with you. Maybe it's a box because you can visualize it. Maybe it's your hands on your heart because you can, and your belly because you can feel that. Like, you just find whatever breath, or, touching and rubbing your ears. My son touches his ears when he's stressed. And I'm like, this is you needing to down regulate. Take a deep breath and just enjoy that, breathe your life into yourself. It's those small, consistent moments that matter and that really allow you to rest and fully support your nervous system and kind of get back into your body. And so that would be my one simple thing. And I know people say, yeah, your breath, but just do it and then see how you feel. And don't wait until you're burnt out to do it. Start practicing today. And then on the days that you're not feeling well, you already have that toolkit that you can go to. And just take a deep breath.
I love the small, consistent moments. I'm leaving with that, and I'm going to take that forward to for myself and to others. But so important, so important. So this has been such a wonderful conversation with you, and I mean, I feel a bit down-regulated. I don't know about you, Jen. What do you think?
Yes.
So thank you very much. And just a reminder, if you liked what you heard today, and please like this, and we'll see you next time.
Thank you. Thanks, everybody.